Hi, my name is Dr. Stacey Bissell and I'm a researcher based at the University of Birmingham. In this video, I would like to outline some of the key findings of a paper we published earlier this year in Orphanet Journal of Rare Diseases. This paper captured the lived experiences of caregivers supporting children and adults with Smith-Magenis Syndrome and is called Caregivers' Experiences of Sleep Management in Smith-Magenis Syndrome, a Mixed Methods Study, and was co-funded by Cerebra and the SMS Foundation UK. Smith-Magenis Syndrome, or SMS, is characterised by a poor sleep profile of excessive daytime sleepiness and early morning waking. This is true for children, adolescents, and adults with SMS. A behavioural profile characterised by self-injury, impulsivity, aggression, and preference to be with familiar adults means that SMS families experience significant challenges. Overnight caregiver supervision is required, and there are significant safety concerns to both the individual and their household. To limit impact to other family members or siblings, the onus falls on caregivers to manage safe sleeping in the family home, alongside the multitude of other financial, social, familial, and occupational responsibilities that they have. Although sleep deprivation and caregiver stress are referenced in some literature, the in-depth lived experiences of families navigating the complexities around medication, service provision, and legal aspects of overnight sleep management in SMS have never been documented. In our study, 40 caregivers of children and adults living in the UK, USA, Europe and Australia completed an online survey of lived experiences relating to sleep management. In addition, I conducted face-to-face interviews with 14 caregivers in person in the UK to determine UK-specific priorities for sleep service provision and intervention. Free text responses from the online survey and transcripts from the face-to-face interviews were coded according to 7 themes: poor sleep across the lifespan, change over time, impact on the person with SMS, impact on caregivers, impact on the wider family, including siblings, safety concerns and strategies, and other management strategies, including co-sleeping and use of medications such as melatonin. An additional theme relating to the need for respite was also captured from interview and survey responses. In the interest of time, I will discuss aspects of the 2 themes relating to safety concerns and respite. Key safety concerns that occurred during night waking noted by several caregivers were attempting to cook unsupervised, self-injury, most notably headbanging, foraging for food, and destruction of property. This resulted in most caregivers noting bedroom adaptations and limiting access to other rooms as key strategies to ensure safety. This included stair gates, video monitoring, enclosed safety beds, and removing furniture from bedrooms. 6 caregivers referred to co-sleeping as a safe management strategy. Understandably, co-sleeping and constant overnight supervision places considerable strain on the family unit. As such, the provision of respite for families from local care authorities was deemed useful by families. However, 54% of our caregivers did not receive access to any respite, despite 49% stating that weekly access to overnight respite would be their ideal provision to support their family. Being ineligible to respite, or the postcode lottery of respite provision in the UK, has a significant impact on family quality of life, and guidance needs to be revised to address these barriers to respite provision. If you are interested in reading more about this study, this paper is freely available to download online. Special thanks here also to the co-first author of this paper, Dr. Georgie Agar, the student who contributed to this paper, Caitlin Williams, Nigel Over, CEO of the SMS Foundation UK, and Dr. Lucy Wild, Dr. Caroline Richards, and Professor Chris Oliver.